Hello, today I will discuss about the male reproductive ultrasonography that will contain the scrotum and its contents and the prostate gland, and we will start from the anatomy, embryology, physiology, lab values, and indication of the scrotal ultrasonography, other modalities used for the male reproductive organs, especially the scrotum and testicles, and the normal sono appearance of the male reproductive organs, and then scrotal protocol techniques. Then we will learn the scrotal pathology, extratesticular, intratesticular. Then we will learn the congenital pathology, infection pathology, tumor, which is benign and malignant, varicocele, and the testicular torsion. So these are the for the scrotum. This is very important for the male reproductive. So then we will talk about the prostate gland, and we'll see that how the prostate gland is bothering the man, and 80 to 90% men elder than 50 years, they have prostate gland problem. We'll explore and we'll see that how the ultrasonography can evaluate the prostate gland pathology. Okay, we'll talk about the anatomy of the male reproductive organs. So, male reproductive organs. What are those male reproductive organs that we're going to cover? So, we will cover the external genitalia, number 2, the ducts, all ducts, there are 4 ducts we'll discuss, and number 3, accessory glands. In the external genitalia, we will know this is penis, scrotum, and testis. Among the ducts, there are 4. One is epididymis, another is ductus deferens or vas deferens. Okay, write down vas deferens. Another is ejaculatory duct. And the last one is urethra. Okay, there are 4 ducts in the male reproductive system: epididymis, vas deferens, ejaculatory duct, and the urethra. For the accessory glands, seminal vesicle, prostate gland, and then bulbourethral gland. Also known as Cowper's gland. Okay, so these are the organs we need to have the idea that external genitalia means we can see externally. Those are penis, scrotum and the testis. Among the ducts, epididymis, vas deferens, ejaculatory ducts and urethra. And the accessory gland, the seminal vesicles, prostate gland and bulbourethral gland. So this is anatomically component part of the male reproductive organs. So now I will show you the embryogenesis. Why embryogenesis is important for the ultrasonographer? Embryogenesis. What is embryogenesis? Means developmental history. How the organs is developed, origins, and is there any connection with other organs for the development? Why? Because we know that there are some infrastructure, from that infrastructures more than one different organ systems developed. If that infrastructure means framework is defective, then multiple organ in the body is defective. Example, one of the common infrastructure like mesonephric tubules that forms the collecting system of the kidney. Minor calyx, major calyx, pelvis. This collecting system comes from the mesonephric tubules and the cortex comes from the mesenchymal cells. If infrastructure, that is minor calyx, major calyx, pelvis do not form, then mesenchymal tissue cannot migrate and settle on top of the collecting system. That means there is no kidney formation. And from that mesonephric tubules, the female reproductive organs are connected because they share same tubules called Mullerian duct. Mullerian duct, another name is paramesonephric duct. That Mullerian duct are two. They appear as a parallel two. From that, the fallopian tube, uterus, cervix, vagina forms. If that paramesonephric duct, which is also needed for the kidney formation, if that is defective, then kidney may not appear, congenitally kidney could be absent, and female reproductive organ would be congenitally deformed. And now, the male reproductive organs, look at here, seminal vesicle. If this seminal vesicle is absent in one side, say if my right side seminal vesicle absent, my right kidney will be absent. So what do you mean by that? That means how they are interrelated. That means if you see somebody's testicles did not form, or it is inside the abdomen, did not come into the scrotum, then you have to check the other organs like kidneys. Because developmentally, the kidney, I told you, kidney starts forming from the cervical region, then it goes down into the pelvic region. From the pelvic region, then finally it ascends into the lumbar region for the kidney. And while in the pelvic region, along the posterior wall of the pelvic cavity, the kidney and the testicles, ovaries for the female, all are close together. Before 1 to 2 months before the birth, the testicle will descend into the scrotum through the inguinal canal, and the kidney will ascend in the lumbar region. If they fail to do that, then you will see the kidney is in the lumbar region, pelvic cavity, testis also in the pelvic cavity. Okay, and this is so much interrelated. Now I will give you the embryo genesis, the idea. I will show you. So, early development of the male reproductive system will have 3 sources. One is epithelial source, epithelial cell source, another is mesenchymal, cell source, another is primordial germ cell. Primordial germ cells source. Okay, from the epithelial cells, there will be gonadal ridge. From the gonadal ridge, there will be primary sex cord. From this primary sex cord, there will be cortex and there will be medulla. From the cortex, ovary will form, and from the medulla, testis will form. From the primary sex cord, retitestis of the testicles will form, and seminiferous tubules. Seminiferous tubules will form. So that means the primary sex cord forms 4 things: cortex, medulla, retitestis, and seminiferous tubules. This is retitestis and seminiferous tubules. These are inside the testis. Okay, and from this, in this seminiferous tubules, there will be differentiation of the cells. There will be epithelial cells. From this epithelial cells, Sertoli cells will form. This is the cell who will feed the young sperm. Sertoli cell. We call it nurse cells. From the mesenchymal cells, interstitial cells of Leydig, or simply called Leydig cell. This is the interstitial cells of Leydig, comes from the mesenchymal cells, and this Leydig cell produce testosterone, the hormone. That is the hormone. And this Sertoli cell is the nurse cells, or nursing cells for the sperm. And primordial germ cells form the spermatozoa. Okay, so now mesonephric tubules, mesonephric tubules will form 4 ducts. One is epididymis, another is ductus deferens, another is seminal vesicle, and another is ejaculatory duct. Ejaculatory duct. Okay, so these are the source. Mesonephric tubules forms these 4 structures, and prostate gland forms from the endodermal outgrowth of the prostatic part of the urethra. That means endodermal outgrowth forms prostate gland, and the bulbourethral gland, and bulbourethral gland. Okay, so this is in short the development or embryo genesis. So here the important thing is that we need to understand if there is a defect in here, primary sex cord, if there is a defect in primary sex cord, then there will be defect to form the ovary, defect to form the testis, defect in the retitestis, defect in the seminiferous tubules. If mesonephric tubules does not form, then all those ducts will not form. Okay? If mesenchymal cell, means mesodermal cells, fail to migrate into the infrastructure, so then testis will be there, but there will be no testosterone. And you know, for the man, testosterone is very important. Testosterone is very important for not only that purposes, for the growth and development and the secondary character. So this is very important. Now, spermatozoa is sperm, right? So if there is no sperm, everything is there. They are enjoying life, but couple is infertile. What does that mean? That means maybe there are ditchers, but the sperm is absent, called azospermia. A means absent, spermia means azo means absent, sperm, no sperm. So the couple is infertile. So these are the developmental errors. So we need to keep in our mind that they are very, very connected. And this mesonephric tubule is helpful for the development of the kidney, and it is also helpful for the development of the male gonads. So when there is a congenital problem in this, so you have to look for, there might be absence of seminal vesicles. Okay, so now if the testis did not descend into the scrotum, then what happened? The testis will be in the pelvic cavity, right? We call it undescended testicles. So normally there is an inguinal canal. On both sides there is an inguinal canal, and this inguinal canal communicates from the pelvic cavity and the scrotum. So these are inguinal canal. The testis will come down through the inguinal canal into the scrotum. Descending testis. The testis can be arrested in the pelvic cavity, testis can be arrested in the inguinal canal. And this undescended testis is known as Cryptorchidism. Cryptorchidism, I'm going to give you my note. Cryptorchidism means undescended testicles. And undescended testicles either in the pelvic cavity or in the inguinal canal. And always keep that in mind. These undescended testicles are non-functioning testicles. And these testicles has more chance of malignancy. That's why after birth, if it is a baby boy, the doctor check if the ball, right, testicles are in the scrotum or not. So if they found that testicles is in the canal, inguinal canal, it did not descend into the scrotum yet, they do the surgery. They will pull the testicles into the scrotum. And one thing you need to remember, that when the testicle is coming down, so this is the testicle is coming down, always there is a peritoneal layer is in front of it. Peritoneal layer. When the testicle comes into the scrotum, so this is testis, and it is covered by the peritoneum